Hello, I'm Dr. Andrew Neville, and I want to talk to you a little bit about hormones. A lot of times my patients, when they come into me, they're on hormones, right? Their hormones are off. And when I say hormones, I'm talking primarily ovarian hormones, estrogen, progesterone, testosterone. The imbalances within the ovarian hormone system abound in adrenal patients. And there's a bunch of different reasons as to why that happens. And what will happen is a well-intentioned doctor will notice, hey, you're on, you've got heavy periods, or you've got frequent periods, bad PMS, things like that, or you've got hot flashes and these menopausal symptoms, right? So let's give you hormones, which is okay, right? It's a little bit at a superficial level because it's actually, believe it or not, this underlying adrenal problem that is really messing with the ovarian hormones. Stress hormone, right, when we're in stress physiology, that goes to what we call the hypothalamic pituitary ovarian hormone axis, and it actually suppresses it. And we know that. That's conventional physiology. And when you do that once in a while, no big deal. Do it all the time, you're going to compromise your periods and have some libido issues, hot flashes, all that kind of stuff. So it's common. So treating with hormones is fine. I don't mind doctors treating patients with hormones, but it might make sense to figure out, why do I need all these hormones? That's kind of an interesting thing, right? Now, there's a couple different ways to use hormones. I tend to prefer what we call bioidentical hormone replacement therapy. What does that mean? Bioidentical means identical. This chemical structure is identical to what your body normally produces. Okay. There are other options, tons. Birth control pill, right? Or other kind of synthetic, right? So it's man-made hormones, which have different brand names, which I'm not going to get into, but those hormones are synthetic. They are different than the actual hormone your body produces. And all of those hormones come with risk. They can't even, so a bioidentical progesterone is identical to progesterone. When you have synthetic progesterone, they're not even allowed to call it progesterone. They have to call it progestin, okay, because it's a different chemical structure. And all of those synthetics come with risk, specifically cancer risk. So treating with hormones, I tend to prefer these bioidentical hormones. They're just identical to what your body produces. I try to recommend, use the lowest level necessary to try to balance these things and to help with symptoms. But remember, it is a symptomatic approach, and it might make sense to try to figure out the underlying cause. The symptoms of menopause, by the way, they're an adrenal problem. They're not an ovarian problem. Your adrenals are designed to produce some of your ovarian hormones. As the ovaries decline, the adrenals kick in, and that eases a woman into menopause without a hitch. In fact, postmenopausally, most of your ovarian hormones are coming from your adrenals. So by fixing the adrenal issues, we can shift the physiology, and all of a sudden, all these problems with ovarian hormones, they gradually go away. Hope that helps.